Hi, good morning. This is Dr. Frawley. This is the blog for this week. I just got in the new Journal of the International Parkinson Movement Disorder Society, June 2020. And on the front page of this is kind of a review that the gut is involved with neurodegeneration. And it's interesting to me because probably one of the number one patients that I'm taking care of are neurodegenerative patients. And I haven't had one patient yet come from anywhere else that has mentioned at all about the gut-brain connection and then the brain-gut connection. So this information's been out there for a long time frame, and it's totally being missed. This information pertains not just to Parkinson's, it pertains to depression, anxiety, bipolar, schizophrenia, OCD, focus, attention, sleep, digestion. All of this stuff can go back. And when we look at the brain from how it actually works, and we get rid of this idea that there's a psychological problem, we start to look at why the brain may be malfunctioning and why you may have certain behavior tendencies. And also why we have to move away from the idea of viewing these diseases from what we're being told that, for instance, all mental health is a genetic problem and there's a chemical imbalance in the brain and you need the drug to correct the chemical imbalance. Not very scientific, can't be measured whatsoever, but we keep talking about it over and over again. I keep hearing people all the time allowing their family to be diagnosed in that crazy system, and now we have someone on these medications, and those medications over a time frame are going to do nothing more than create more brain imbalance. So we must look at what the causes are. We have these neurodegenerative, and by the way, in my opinion, depression, anxiety, bipolar, schizophrenia, OCD, these are all signs of neurodegeneration. They're early signs of neurodegeneration. And they may not be early. They may be moderate to late stages of neurodegeneration. And then we have the other neurodegenerative patients coming in, which is the Parkinson's, multiple sclerosis, Lou Gehrig's disease, dementia patients. And we also know now again that the gut plays a major role in that. And they're almost saying that, at least in this article here, that the changes in the gut will precede the neurodegeneration by years and years and years. Some of the testing that we do in here, direct blood testing, specialty testing, and even some of our other autonomic testing can pick up dysfunction in your autonomic nervous system and in the gut specifically that will precede, getting symptoms down the road. By the time you get symptoms, we're almost dead. We have to realize that. Symptoms don't come until there's massive damage, massive. So we must start looking at our health very differently. You must start measuring, am I healthy or not? You cannot go by how you feel. If you go by how you feel, when there's enough damage that happens, which is 85% on a cell has to be damaged for you to get a symptom, you're dealing with a very, very, very broken down system. So if you go into your medical doc and you say, hey, I want to know if I'm healthy or not. I want to know what's going on with me. And all I keep hearing from my patients that go to the medical doc, my cholesterol is a little bit elevated. I might have high blood pressure, or I'm a diabetic. Besides that, what are we even talking about? And also, if we do have those things, what do they mean? Why is the body doing that? We have to get much more detailed, much more intelligent about how and who we listen to about our health. You cannot pop pills to get healthy. It does not happen. It's never going to happen. And all we continually see is that people are breaking down more and more and more. So with this new journal article that comes out, again, we see that the gut majorly impacts the brain. And the brain runs the show. The brain runs the show. So if the brain starts to break down because of the gut, and then the brain is controlling the gut, now we've got this back and forth negative pattern going all day long, and gradually someone's health really spirals out of balance. Then we can start to get hormonal imbalances. So this is all the menopausal women, all the andropause women, everybody that's walking around talking about now how they think that menopause, it's normal to have hot flashes, vaginal dryness, depression, mood swings, low libido, none of that is normal. Gradually over a time frame, if the nervous system, which is the backup system for when the hormone changes happen inside the woman and they start to go down, if that backup system, which is your HPA stress axis, is working properly, you will transition seamlessly and have no major symptoms. If you're starting to get those symptoms, we must go back and look at how the nervous system in the brain is working. So what's the moral of the story here? There's a tremendous amount of information, again, that the gut-brain, brain-gut, they play on each other. We're experts in this. We do more testing than any office I've ever seen in identifying this and trying to figure out what are your specific root functional causes. I have patients coming in here and they're trying to get the magic bullet. What is my magic diagnosis? Never going to happen. This idea that there's one problem with patients that have chronic issues is totally ridiculous. I find inside of patients 10, 20, 30 problems going on. 30 functional problems creating the mess that's showing up with whatever it is that you're having. So if you have symptoms, there's 85% damage, you better take action. Also, I want to bring this up too. If your insurance covers some of it or none of it, should you invest in this? I don't think there's a better investment that you could possibly make than investing in your health to identify what's going on with you or your family. I see people buy cars and spend money like it's going out of style. And then we talk about, hey, this needs to be done for your health. And people go, oh my gosh, so if my insurance doesn't cover it, I'm not going to do it. It's really ridiculous. So then the other question is this. So why doesn't my insurance cover it? We can talk about that all day long. You must invest in your health, in time, effort, and then get some self-discipline to understand how and why we're seeing so much disease and how and why we're seeing so many people living well below their optimal level of function and then getting into all kinds of issues. I see families being disrupted and broken up because we're having these diagnoses. And people are being told that they have mental illness and being given these drugs. That once you throw these drugs into someone whose brain is fragile, most of the time you're going to see that you're dealing with someone that's almost like in a drunkard state, that you can no longer deal with them. Their brain just doesn't process things properly. And then we're being told this is just part of that disease, when realistically it's probably not at all part of that disease. We haven't identified at all why the brain is behaving like that. And now on top of that, we have this very crazy chemical toxic drug that's being thrown in there. Ask for the tests. Ask for the objective evidence. Ask for something more than a silly name based on theories. Can you show me something? Can you show me outcomes? Is there going to be a huge difference if I'm going to do this? Anytime we're taking a drug, there should be risk versus benefit. If there's a huge benefit in someone, and I tell my patients all the time, if there's a huge benefit to you, you're probably going to do it. But if you come in here and you go, I don't even know if it's working, and I'm taking 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. I've seen people on 12, 13, 14 drugs. We must think differently. We must go back and look at the entire way we're doing things. You don't need a second opinion. You need a new opinion. And a new opinion must have fresh ideas based on function. We're experts in function. If you want to get at the root functional causes and understand how to restore functional capacity inside your brain and your body and your mind, we're experts at that. If you have any questions, please let us know. And I hope you have a great day. Thanks very much.